Hello there. I'm Dr. Ellis, and I've been helping folks just like you stay healthy and active well into their golden years. Over 65? If that pesky swelling in your legs or ankles is making it tough to get around, you're not alone. It's something many of us face as we age. But here's the good news. Simple changes in what you pick at restaurants can make a real difference in easing that puffiness and getting you moving comfortably again. Research from the National Institutes of Health shows that cutting back on high-sodium foods helps reduce fluid retention, especially for older adults dealing with peripheral edema. Today, we'll dive into why this happens, spotlight 7 common restaurant side dishes to skip, and share tasty, low-sodium swaps backed by solid studies. Plus, we'll cover gentle moves and an easy plan to keep swelling at bay. Remember, this is educational info chat with your doctor for personalized advice. Let's get you feeling lighter, starting right now. Why does this swelling start showing up more after 65? Here's the short answer. It's often tied to changes in how your body handles fluid and circulation as you get older. Think of it like this. With age, your veins may not pump blood back to your heart as efficiently, letting fluid pool in your legs and ankles. This is called venous insufficiency, and research from the National Institute on Aging explains that our bodies become more sensitive to salt, which can raise blood pressure and lead to that puffy feeling in your lower body. A study in the Journal of the American Geriatric Society, backed by NIH data, found that peripheral edema affects many seniors, linked to factors like sitting too much, extra weight, or conditions such as hypertension. Let's break it down simply. First, your kidneys play a key role in balancing fluids, but they work less effectively over time, making it easier for sodium from foods to cause retention. The Centers for Disease Control and Prevention reports that excess sodium, often hidden in restaurant meals, can worsen this by pulling water into your bloodstream, increasing swelling. In fact, CDC guidelines note that older adults with heart concerns should limit sodium to avoid fluid buildup, as seen in heart failure management, where cutting salt helps reduce edema. Second, muscle loss, or sarcopenia, means weaker leg muscles that don't help push fluid upward like they used to. A systematic review from the National Institutes of Health shows that age-related muscle decline contributes to poor circulation in about half of seniors over 70. And third, everyday habits add up if you're less active. Gravity pulls fluid down, especially after salty meals. The good part? Studies suggest that tweaking your diet and adding light activity can ease this. For example, the physical activity guidelines for Americans from the CDC recommend at least 150 minutes of moderate movement weekly for older adults to improve circulation and strength, which pairs nicely with smarter food choices to fight swelling from the inside out. Let's start with your plate, because what you choose at restaurants can make those swollen legs feel so much lighter. Small swaps like picking fresher options over salty ones add up to real gains in comfort. As your doctor, I've seen patients cut down on hidden sodium and notice less puffiness within weeks. Research from the Centers for Disease Control and Prevention shows that limiting sodium to under 2,300 milligrams a day helps reduce fluid retention in older adults, especially if you have hypertension, which affects circulation. A study in the Journal of the American Geriatric Society found that high salt intake worsens peripheral edema in seniors by pulling extra water into your tissues. Now, when you're out eating, watch those side dishes. They're often loaded with sodium from processing or seasoning. First, skip the French fries. They're fried in oil and salted heavily, sometimes packing over 500 milligrams of sodium in a small serving, which can spike swelling overnight. Studies from the NIH link excess sodium to increased leg edema in folks over 65. Instead, ask for a baked potato with the skin on. It's rich in potassium, and NIH research suggests potassium-rich foods like this can help flush out extra fluid by balancing your electrolytes. Just a medium one gives you about 900 milligrams of potassium to counter that salt. Second, avoid mashed potatoes. often whipped with butter and salt, adding up to 400 milligrams or more of sodium per scoop. The CDC warns that such hidden salts contribute to water retention in seniors. Try steamed broccoli or green beans as your side. These veggies are low in sodium and high in magnesium, which a prospective study from the Journal of the American Medical Directors Association found helps improve muscle function and reduce frailty in older adults, easing that heavy leg feeling. Third, pass on the coleslaw. It's usually mayo-based and salted, with around 300 milligrams of sodium in a cup, aggravating edema as per NIH data on fluid balance. Opt for a fresh garden salad with no dressing or a light vinaigrette you control. Add some avocado slices for healthy fats. Harvard School of Public Health notes that potassium in avocados supports better circulation, helping minimize swelling. Fourth, don't fill up on the bread basket. Those rolls or biscuits can have 200 milligrams of sodium each, and eating a few multiplies the issue. A CDC report highlights how excess carbs with salt lead to bloating in older bodies. Choose a side of fresh fruit like sliced apples or berries. Instead, they're naturally low sodium and anti-inflammatory. Peer-reviewed research in nutrients journals shows berries' antioxidants may decrease chronic inflammation linked to edema. Fifth, steer clear of soup as a side. Even vegetable soups at restaurants are often canned or broth-based with over 800 milligrams of sodium per bowl, worsening venous issues according to the National Institute on Aging. Go for grilled asparagus or zucchini. These are magnesium-packed, and a study in the American Journal of Clinical Nutrition indicates higher magnesium intake associates with less leg discomfort in seniors. Sixth, avoid onion rings or fried veggies. They're battered, fried, and salted, easily hitting 600 milligrams of sodium, which the NIH connects to higher edema risk. Swap to a quinoa salad if available. It's protein-rich and low sodium. The nutrition source at Harvard emphasizes whole grains like quinoa for their anti-inflammatory benefits, supporting healthier fluid levels. Seventh, skip the pickles or olives on the side. They're brined in salt, with one pickle having up to 800 milligrams, directly contributing to puffiness, as CDC guidelines explain for heart health. Try cucumber slices with a squeeze of lemon, hydrating and potassium boosting, per NIH findings on electrolyte balance. Beyond sides, sip water with each meal to stay hydrated, aiming for 8 glasses a day, as dehydration makes swelling worse. If your doctor agrees, consider a magnesium supplement, but start low at 200 milligrams. Studies suggest it may help, but check for interactions. Today, try swapping one salty side for a veggie at your next meal, and note how your ankles feel tomorrow. Now, let's move together to get that blood flowing and ease the swelling in your legs. Grab a chair for support if you need it. We'll start slow and keep things safe. As your doctor, I always say, listen to your body. If something feels off, like sharp pain or dizziness, stop right away and check with your physician, especially if you have heart issues or joint problems. Start with just a few reps and build up gradually over weeks. Research from the Centers for Disease Control and Prevention and their physical activity guidelines for Americans recommends at least 150 minutes of moderate activity plus muscle strengthening and balance work weekly for folks over 65 to improve circulation and reduce fluid buildup. First, a quick warm-up to get ready about 2 minutes. Stand or sit tall and do gentle ankle circles. Point your toes and rotate your foot clockwise 5 times, then counterclockwise, switching legs. This loosens things up and boosts blood flow right away. Next, try marching in place. Lift your knees alternately, like a slow walk, for 30 seconds. Studies from the National Institutes of Health show that simple leg movements like these can help prevent fluid pooling in your lower limbs by activating your muscles. Now for strength building, which is key to pumping fluid upward. Let's do seated heel raises, great for your calves. Sit in a chair with feet flat on the floor, hip-width apart. Slowly lift your heels off the ground, rising onto your toes, then lower back down. Aim for 10 reps, 2 sets. If your knees hurt, do a half range, just lifting a little. A systematic review in the Journal of Strength and Conditioning Research found that resistance exercises like this improve leg strength in older adults, helping combat swelling by enhancing muscle pump action. Next, the sit to stand. From your chair, feet flat. Stand up fully without using your hands if you can. Then sit back down controlled. Do 8 to 10 times. For an easier version, use your arms for support or stand only halfway. This targets your thighs and glutes. Research from the National Institute on Aging highlights how such moves build lower body power, reducing edema as seen in trials where seniors saw less leg puffiness after regular practice. Then, try a wall, squat hold. Stand with your back against a wall. Feet, shoulder, width. Slide down until your knees are bent, like sitting in an invisible chair. Hold for 10 seconds. Then stand. Modify by not sliding as low, or skip if knees bother you. Studies suggest this strengthens your quads, and a PubMed review from NIH notes that loaded leg exercises decrease foot volume in older folks. One more strength move. Step taps. Stand facing a low step or just tap your foot on the floor alternately, like climbing stairs slowly, for 20 taps per leg. This gets your heart rate up gently. If balance is tricky, hold the chair. For balance, which ties into better stability and circulation, do a heel-to-toe walk. Place one foot directly in front of the other, like on a line. Take 10 steps forward, then back. Use a wall or chair for support. Mayo Clinic research shows balance drills like this improve steadiness in seniors, aiding overall leg health. Finish with stretches. For calves, stand facing a wall, 1 foot back, heel down. Lean forward to feel the pull. Hold 20 seconds per leg. For hamstrings, sit and extend one leg. Reach toward your toes gently. A study in the International Journal of Environmental Research and Public Health found stretching enhances flexibility and reduces swelling risk. Remember, Jane, a 8-year-old patient of mine struggled with daily ankle swelling. After adding heel raises and ankle circles twice a day for 8 weeks, her swelling dropped noticeably, mirroring findings from a small NIH-backed trial on leg exercises. Today, pick 2 moves like heel raises and marching and do them for 5 minutes. You'll feel the difference. Here's your simple 7-day plan to tie it all together, easing that swelling with the swaps and moves we've covered. Think of it as a gentle routine that fits into your day without overwhelming you. Start slow, maybe just 10 minutes at first, and increase if it feels good. Always consult your doctor before beginning, especially with any health conditions, and stop if you feel pain. On Mondays, Wednesdays, and Fridays, begin with your 2-minute warm-up of ankle circles and marching. Then do 3 strength moves. Seated heel raises for 10 reps, sit to stands 8 times, and a 10-second wall squat hold. Add the heel-to-toe walk for balance, 10 steps, and finish with calf stretches, holding 20 seconds per leg. That's about 15 minutes total. Research from the Physical Activity Guidelines for Americans by the USS Department of Health and Human Services shows this mix builds strength and circulation in older adults, reducing edema over time. Tuesdays and Thursdays, aim for a 15 to 20-minute brisk walk outdoors or around your home. Use a cane or walker if needed for safety. Daily, drink 8 glasses of water and make 1 restaurant swap, like choosing steamed veggies over fries when eating out. Weekends, keep it light with something you enjoy, like gardening or a short stroll with a friend. To track progress, note your evening ankle swelling on a scale of 1 to 5, and time how long you can balance on one leg with chair support. Start today and check weekly. Studies from the National Institute on Aging suggest consistent tracking motivates seniors, leading to better outcomes. Take Mary, 72, who followed this for 4 weeks. Her swelling notes dropped from daily to twice weekly. echoing a small CDC-linked study on activity and fluid management. Stick with it by setting phone reminders and pairing moves with your favorite show. You've got the tools. Small steps lead to feeling steadier every day. You've got this. Small steps like these can lead to noticeable relief from swelling. Here's what to do next. Try the 7-day plan for at least 2 weeks, tracking your ankle swelling and balance time. Then share your results in the comments below. I'd love to hear how it's going for you. For more tips, check out my next video on compression basics to support your legs even further. If you enjoyed this, hit subscribe and the bell for notifications on senior health hacks. Remember, this is general guidance. Always consult your doctor for tailored advice. You're taking great steps toward feeling lighter and more active. Keep it up and celebrate every win along the way.